A 25-year-old woman at 9 weeks of pregnancy comes to the emergency department after noticing light vaginal bleeding earlier today. She describes it as spotting that began suddenly and has been intermittent. She denies passing tissue and has only mild lower abdominal cramping. This is her first pregnancy, and she is understandably worried. On arrival, her vital signs are stable. She looks anxious but is in no distress. Abdominal exam shows only mild suprapubic tenderness. A pelvic exam reveals a small amount of blood in the vaginal canal, but the cervical OS is closed, an important finding when evaluating early pregnancy bleeding. A urine pregnancy test is positive, and blood work shows an appropriate β-hCG level. A transvaginal ultrasound is performed. It shows a single intrauterine pregnancy with a fetal pole and normal cardiac activity. There is no subchorionic hemorrhage or evidence of miscarriage. These findings support the diagnosis of threatened abortion, vaginal bleeding in early pregnancy with a closed cervix and a viable fetus. Threatened abortion is common in the first trimester and often caused by implantation bleeding, hormonal changes, or minor placental separation. Most pregnancies with fetal cardiac activity continue normally, but the patient is monitored closely for worsening symptoms. Management focuses on reassurance, hydration, and avoiding heavy lifting or intercourse until the bleeding resolves. She is advised to return immediately if bleeding becomes heavy, pain worsens, or she develops dizziness. Follow-up with her obstetrician is scheduled to repeat ultrasound and monitor pregnancy progression. Key takeaway: vaginal bleeding in early pregnancy with a closed cervix and a viable fetus indicates threatened abortion. Ultrasound confirmation and supportive care are essential, and most pregnancies continue safely with proper monitoring.